Good Monday morning, everyone. It is the first day of November. Can you believe it? Welcome to the Morning Medical Update. Thanks for joining us via Facebook, Twitter, and YouTube on today. Glad you're with us. As soon as this week, kids 5 to 11 could get the go-ahead to receive the COVID-19 vaccine. So what is the best way to mentally prepare them for the shot? What parents need to know so that they can make the best decisions for their families? And also just the basic psychology behind whether or not you should get the vaccine as we still wait for others to come around. So we're going to also talk about how to have a constructive conversation and help educate those folks who are still on the fence. So make sure to get in your questions to YouTube, Facebook, Twitter, and the Medical News Network. You can find links to all of those right there on your screen. Now, let's get to our COVID count. Medical Director of Infection Prevention and Control, Dr. Dana Hawkinson, joins us this Monday. How do we look coming out of the weekend? Good morning to you, by the way.
Yeah, I mean, we're holding steady. We are right now at 18 active infections with 7 in the ICU and 2 on the ventilator as well. So of those 18, 2 total people are fully vaccinated. And we still have an additional 29 that meet that recovery period, so a total of 47 patients.
All right. Thanks for that update. How was your Halloween? I have to ask.
It was good. Just hung out. It was a fairly nice weekend. So.
Was it good? Yeah, it was. It was a little cold last night, but lots of candy.
That's right.
Lots of amped up kids. All right. Let's get to our reporter questions. Any on the line today? Got nothing. All right, so we're going to get to our community viewers here in just a moment. So get those questions, start thinking, because I need some help with this, especially parents who have 5 to 11-year-olds. But first, let's get to some stats. So just how many parents are willing to get their children vaccinated once it is approved? There's a new survey that suggests that without a doubt, it's very uncertain at best. According to the Kaiser Family Foundation, only 27% say that they will vaccinate their children against the virus as soon as that vaccine becomes available, which could be just within the week or so. The majority of parents say they will not get their younger children vaccinated right away. That number has stayed pretty much the same since July, but still around 70% of parents polled said that they have some hesitations getting their kids vaccinated right away. Doesn't mean that they won't eventually, but you think everyone's running out there. They're not. That's why we are so glad that Dr. Danielle Johnson is joining us. She is a child psychologist here at the health system. How are you?
I'm good. How are you?
Oh, good to see you. Did you have a good Halloween?
We did. We had lots of candy and more candy.
Lots of candy
yes.
And even more candy. I know. My kids were, 5 a.m.
Yeah.
going through the candy this morning. Yeah. Okay. So good. We are glad that you are with us. You are a child psychologist here at the health system, but you also work with our young patients out at our Marillac Campus, and you guys have done so much great work over COVID. We're going to get to the vaccine and talk a little bit about that, but I would be remiss not to just jump in because it's so important to talk about kids' mental health right now. So I want, first of all, you to tell everyone what Marillac is, what kind of services they provide to our community, who you serve, so that people know that it is available for them and their families.
Yeah. So Marillac is a campus that serves our 4 to 17 population. We are an acute inpatient psychiatric hospital that works with kids that are struggling with depression, anxiety, PTSD, trauma, a whole host of things that keep them unsafe in the community. Our job is to get them there, get them stable so they can safely return to their home and work really hard in their community to work on their mental health. And over the course of the last 20 months now that we're into the pandemic,
Yep.
we have served so many children. But because of the pandemic, we've also had to reduce our bed capacity. We want to keep kids safe, and so we are limiting kiddos to single room occupancy. But in the last, 7 weeks now, we've been able to open up some of our rooms for double occupancy for kids that are vaccinated.
So we don't like to hear higher numbers, but we do like to hear that parents are utilizing the service for kids.
Yes.
Take us kind of down the timeline from, because you were very concerned at the beginning of this pandemic because you weren't seeing people coming in.
Correct.
I think the general public would think, oh, well, that's good news. Yes. It was not good news for you all.
No,
So what have you seen it evolve to?
Yeah, so initially in the pandemic, kids weren't being admitted. We had a draw in of everyone staying home, and so we did not see admissions. In part, we saw kiddos at home, and for those first few weeks of the pandemic, I think we were all just kind of nervous of what was happening, didn't know what was going on, and kids weren't in school, which is a number one stressor for kids and parents when their kids are in school. And so we had a reduction in admissions, but that number bounced back come summer when we saw a bounce back of kids being admitted for depression, anxiety, suicidal ideation. And part of the impact of the pandemic has been pretty heavy on kiddos. They've had times of uncertainty. Families have lost jobs. members have died. So we've had kiddos that have been struggling with a whole range of stressors that adults also struggle with less support.
So this pandemic has really shown you and shown families how much you're needed.
Yeah.
I think a lot of times this kind of goes under the rug because you're so lucky to have your kids in school.
Correct.
And they have some of those resources and they have the counselors and the teachers and the friends and the coaches. But now it fell so much on the parents and the family dynamic to make sure that they were keeping that eye on them. And it was always, and when I would talk to your team, I think it was that trying to find that balance between, we were so happy that kids were being homeschooled because we felt like, kids are at home and they're safe. But I would hear you and your team say, not necessarily.
Because many parents had to work during the pandemic and many parents could not work from home. And so if you think of our first responders, frontline workers, they had to be in person during the onset and continuing during the pandemic. And so they had kids at home and they had to be at work. And there's a lot of safety issues that come with that.
To say the least. I mean, it's great if you're in a position where you have a stay-at-home parent and everything's great, but that is clearly not the case with most households. People got to work and kids have to be watched. So let's talk about, and you and I have had this discussion before, we're going to talk kids, but I just want to talk in general the psychology of whether or not to get the vaccine and how we manage all of that, because we are working with people who are vaccinated, unvaccinated. We live next to people vaccinated, unvaccinated. How are we supposed to figure our way through all of that?
Great question. And so what we think about is risk reward. For those of us who have a higher chance of getting sick from COVID, we're more likely to go get the vaccine. So those of us that have worked in person during the pandemic, we're at a higher risk of being exposed, therefore a higher risk of contracting the virus. I think those people are more likely to get the vaccine because they just have a higher risk. For some people, they've worked from home for the last 20 months. They may get their food delivered from a service. They may do DoorDash for takeout, and so they have very limited risk. Those folks are probably less likely to get the vaccine. We also think of, is this safe? We have overwhelming evidence that it is safe, but we also have social media and misinformation that can plant a seed of, maybe this isn't the most safe thing. When we think about how quickly the vaccine was rolled out, people give hesitation and pause to that, and this is something different. And there is space to talk about that this was rolled out for some people very quickly, despite the evidence that supports that this is safe, just as safe as any other vaccine that we take or any flu shot or any medication we take. This is just as safe. There's also the idea of collective responsibility. If I feel that what I do impacts my greater community, I am more likely to get the vaccine because I am doing good by my community. We also think of time constraints. As I mentioned earlier, not every parent was able to work from home. And if you think that I might have side effects and be down for 2 days, and if I don't work those 2 days, I don't get paid for those 2 days, some folks are just in a position where financially, that's a hard decision to make. So there are a number of factors that impact our decision making on to get the vaccine or to not get the vaccine. But I encourage everyone to talk to their healthcare providers, trusted family, vetted resources.
If only it were all this easy, Dr. Johnson. Everything you just said, if everybody could hear that, but we know that's not the case. So how do we educate versus judge people? And I mean, let's be honest, just get raw and real with us, because that's what this has turned into. It's we know there are people who legitimately cannot be vaccinated for certain reasons. We get that. There are people who are still trying to gather more information. Dr. Hawkinson has always said, like, I don't know what more information you need, but it's still out there. I mean, so we don't want to judge those people. We want to bring them along. And then there are people who politicized it. So just help us have those conversations. What is the best way? I think it's like we're trying to vaccinate people one person at a time. So if something I say can make someone get the shot, I want to make sure I'm doing it right.
I think number one is to not judge. I think you said it very nicely. We cannot judge. We cannot have an argument about this. I think we go into some of these situations very passionate because it's important to us all. And so that passion, if we can turn that passion into giving an open space to have a conversation. This is a conversation. The person that's kind of worried the vaccine, what are the questions that you have? How can we help support them and answer all of those questions, not in this judgmental stance, but hey, I know you've got concerns about this, and I've had the same conversation at work. I've got coworkers who've been hesitant, and to have a conversation of, what are your concerns? And I've had people give me resources that they've looked at that are not vetted. They are YouTube videos of people being feisty about how the vaccine's not good for you. And to talk to that person about, let's go to a vetted resource. Let's go to the CDC's website. Let's go to KU's website. Let's go to actual resources that have the science and evidence behind them versus someone on the internet saying X, Y, and Z.
Watch this show.
Yes.
Watch this show.
Every day.
and hear our doctors say it. So what are some then, you've kind of said it, but just, and maybe we'll come back to this because I want to hear some useful tools that we can have when we get into those conversations. But I do want to talk about kids.
Yeah.
How do we start having that conversation with them? I mean, we're just days away.
Correct.
And we know that not everybody's going to flood to the lines to get their kids. But for those who are, how do we start telling our kids about it?
I don't separate this vaccine from any other vaccine that kiddos get. They all go every year and get a flu shot. They go for their well-child checks and as scheduled get their vaccines for those well-child checks visits. This is no different.
But there's not as much bickering about the flu shot that they hear on TV.
In my household, they have a lot of bickering about the flu shot.
And your household, I know.
Kids don't like shots.
They don't like shots. They don't like shots.
At the foundation of this, kids don't like
but,
shots.
But, you know, I think kids have heard parents, teachers, kids at school, the playground. My parents say this, your parents say that, and then they hear it on the news. And so the flu shot, just unfortunately, with what we're hearing, is not like the COVID shot because, again, it's been so politicized. But I want to talk about, because I'll have to be honest with you, and I want some other parents to send some questions in, because I was even thinking about this. I was like, for me to get the shot, I ran right out and got it. I got that because that was my choice. But you know, when you're making a choice for another human being, and my 5-year-old is his own separate human being, my 8-year-old's her own separate human being, your kids are.
Yes, they are.
And you're making a choice for another person. That does mess with your mind a little bit. So help us through that. You know, that you're making a decision for another person. It's easy for you.
Correct.
But they're not making it. You're telling them to do it.
Correct. We are saying we have to go get this vaccine. So what I do with my own kids and what I tell parents with their kids is to have a conversation. We are getting these vaccines, these shots, because they keep you safe. Just like you wear a seatbelt in the car to keep you safe, you get vaccines so you don't get sick with certain things. It's easy to tell kids, oh, this is really important, but a lot of kids have struggles. And as you said, older kids have been on the playground, they've heard other parents talk, they've heard kids talk, and I think for most kiddos, they have a direct correlation to COVID. They wear a mask at school. Every single day they get a reminder that COVID's here and COVID's real. They hear some things on the TV about people being sick with COVID. And so for kiddos to have a discussion of this truly is what keeps you safe. This truly is what gets us closer to having school look normal. For a lot of kids, your parents can't come to school right now because schools are still restricting visitors. And so even though we might not lose the mask immediately, having more kiddos and more adults vaccinated also means parents get to come to class parties. And most kids love to have their parents at the class parties. Also talking to kiddos about, you may hear other parents say things, you may hear other kiddos say things, but let the kids, to let them know, as their parent, you have the final authority over what they say and do. And so to really reaffirm that other households may do things differently. Other households may let their kids eat all the Halloween candy Halloween night, but not in our household. So you have those same conversations about different households do things differently, and to let them know you are their source of support, you're the source of information, and to come to you with all those questions and concerns. But your ultimate job as a parent is to keep them safe, and that's what you're doing by having them get vaccinated, and to affirm that over
and that you've done the
again.
research.
Yes.
So where's the disconnect then between unvaccinated people, vaccinated people, or parents who are literally waiting and the clock is ticking? When is that vaccine going to come out for my kids versus the ones who are still saying, no way, I got to wait for maybe full FDA approval or maybe not even getting it all. So where is that disconnect? Why are so many people eager and so many people so hesitant?
I think we're cautious people. I think most of us don't like change. We don't like things that come on suddenly without us preparing and planning for it. And for some people that have those questions and concerns, there's been enough, I think, misinformation funneled in to really sow those seeds of doubt. And so for those folks that have that doubt, having that reaffirmed by their sources of information, which we tend to go to what we agree with. And so if I agree with it, I'm not sure about this vaccine, I'm going to find more sources that support my wariness of this vaccine. For those of us that may say, no, I believe in the vaccine, I wanted it yesterday, we're going to go to sources that support that. And so if we can find a friend, a colleague, a family member that may have just a different opposite point of view that can help to add some more information that kind of makes you challenge that makes you really sit and think about what's in my best good, what's in the best good of my family or my community. That may be a helpful way of opening that door to think about doing something a little bit healthier.
I like that. Dr. Hawkinson, I want to bring you in here because, we could talk about numbers and statistics and studies, but I think something, Dr. Hawkinson, that was really powerful that you did, is you backed it up. You backed up your word when you had your kids right here on our show get their vaccine. With dad standing right next to them, giving the thumbs up, saying, this is safe. You would never put something in your kid's arm that you did not feel 100% that this was right. So talk us through kind of, you're the parent here that's had your kids vaccinated. Tell us a little bit about that.
Yeah, I mean, I think that's the key, is that we have to be the adults, and that's why we are the parents. We don't want the prisoners running the jail, if you will. I think it started early for me, and everybody will have a different story. But again, just growing up, that was just always something we did. My parents were educators, but we would always go to our doctor's appointments, always get the vaccine. And also, I think you can have some discussion, but the other thing is, what is the capacity for those children to really understand what's going on? I think simple terms, and certainly Dr. Johnson can correct me, but the kids take their cues from the adults, and if you minimize it and make sure it's not a big deal, they're going to get through it just fine. It's a very minimal thing. So I think there are a lot of aspects to that, and would certainly welcome any of Dr. Johnson's comments as well. But I think it's just being that adult, understanding and knowing what the true facts are, the protection that these vaccines provide, whether it's this vaccine or, more importantly, all those other childhood vaccines for those vaccine preventable diseases, which because we are standing on the shoulders of the people that came before us, we don't have insight to really exactly what those disease processes look like and what were the complications and how children were getting very ill for some of those other diseases. So I think we have to take it all into context. But really, I think the biggest thing is the children take their cues from the parents, from the adults. And so it is so important therefore that the adults have all the accurate information. But continue to get that, continue to take them to their regular physician's visits and speak with those doctors and get all that information. But otherwise, it is, as we heard Dr. Johnson say, it is just another vaccine, and they've had plenty of vaccines. And these are all going towards the goal of keeping them healthy. And really what we see also is that the more people that are vaccinated in a household, the better that household is for decreasing rates of infection around there and around those bubbles.
So Wyatt and Caroline are a little bit older than our kids.
Yep. Yeah.
We might have to chase them around the doctor's office a little bit. But what was the conversation like? I mean, your dad, you said, we're getting the vaccine. This is when we're doing it. And they just said, okie doke. Is that kind of how it went down?
Yeah, that's how it is every year. All right, well, it's Tuesday evening. Here we're going to go to wherever and get your flu vaccine.
All right.
So it's a matter of fact thing. It's minimized. It's not made a big deal. Certainly when they were younger, we got them some candy or whatever afterward. But now they just understand and know this is what has to happen. And hopefully, I think the main part is it's setting a good foundation for when they are adults so that they can make those informed decisions on their own.
Sure. What kind of bribes will you be using?
Our household uses donuts. That's
Donuts are good. McDonald's are good here. Yeah. Whatever it takes. Yeah. We give full permission to do whatever it takes, right?
Correct.
Dr. Johnson, what's the one message you want parents to know about this vaccine? We're going to get to some community questions, but just what do you want people to know about it when it comes to their children, it comes to having that conversation? Just let us have it.
Yeah. I think Dr. Hawkinson, you said it very nicely as well, that this is a simple thing that we do every single year for flu and other vaccines, that this is no different than that. It's keeping them safe. It's keeping us safe. As a parent, I get to make the decision for my kiddos that, yeah, this is what we do. We keep ourselves safe. We keep our community safe. As a matter of fact, I actually videoed my first vaccination of the COVID vaccine and went home and showed my kids my video of me getting my first vaccine back in December. They've seen it multiple times. They knew at the outset that when the vaccine was available to them, they would get it. And it wasn't a big kerfuffle in our house. They just kind of had expectations that we go to the doctor, we get checks up, we get safe, and
business as usual.
Yeah, and we get to model that. So as Dr. Hawkinson said, we model behaviors. And so when we model that this is safe, this is effective, this is what we do, there's not much discussion about it. This is just kind of the expectation.
Absolutely. All right, I want to get to some community questions. And Dr. Hawkinson, Joanne wants to know, I know they said people with compromised immune systems, people over 65 at high-risk jobs, should get the booster. What about the rest of us? Will we need that booster or third shot? Just any updates on that?
Yeah, I mean, really, right now it's pretty vague and broad as to if you are just over 18 who can get the extra dosing or that booster, that third dose. And really, it's open up to a lot of people right now as far as even just if you have high risk of exposure. So, yeah, I mean, eventually it will probably be like that
For all of us,
for everyone. Yeah.
everyone. Okay.
But again, I think we have to understand why exactly are we needing it. Again, the vaccines, the immunity induced, even way back from January, February, still have very good effectiveness at keeping you out of the hospital and going to the ICU and dying. Certainly, if you're in some of those other categories like age or other comorbidities, you're at more risk. But even if you got vaccinated early on in the year, you still have very good protection against hospitalization, severe disease, and death. And really, that is what these vaccines were made to do.
On our topic today, Jennifer wants to know, do we have updates on when those vaccines will be available for 5 to 11-year-olds? Where are we at?
I thought we were still looking for Pfizer now at maybe the first couple weeks of November. So starting now, I believe, is when ACIP will be meeting sometime soon. I just saw a headline today that Moderna is kind of pushing theirs back a little bit. So I think the FDA is looking for more information. But I think for Pfizer, it is still, I think, proposed to be within the next couple weeks here.
All right. Donna wants to know, why is it that so many healthcare professionals and caregivers are not wanting to get the vaccine? They are serving our very vulnerable populations and are around a lot of people every day, but they're concerned about getting the vaccine. Help us understand that, Dr. Hawkinson.
I can. I don't know overall their reasons. I think Dr. Johnson might have a little bit more insight, but I think there are a variety of reasons. I think there are that select few that we've had every year, which is very few considering the amount of employees we have that don't get the influenza vaccine. Most of those are really medical reasons because of documented allergies to the influenza vaccine. We don't really have this problem too much right now with the COVID vaccines as far as anaphylaxis. Very, very, very minimal or few cases of actual anaphylaxis to those vaccines are occurring. So I think it's a combination of not so much medical issues, but other political or philosophical issues more than anything.
All right, so you have got to help us understand the psychology with this, because this is messing things up, because this is a question we get. I've heard doctors say that I shouldn't get the vaccine, or I have a friend or a sister or a neighbor that's in healthcare and doesn't want the vaccine. That is definitely the wrong message to send, because if you are trusting people who have that know their stuff, that they're not getting it, what is that telling people?
That is telling people to not get the vaccine, which is the polar opposite information we want people to know. I think there are some people that are in healthcare that this issue has been politicized, and there's kind of, I think, the backdrop of just this highly political state we've lived in for the last, 5 to 6 years, that has taken an impact on people, that they have very firm beliefs about how things are supposed to be and their ability to be free and live the way they want to live, that don't reconcile with their employment. And some people are having a really hard time to be able to take those two things and tease them apart of what's in the best interest of my own personal health and my own community health and my political views. And those things have gotten so muddy for some people that it's very difficult to make a decision. And if we could break those two things apart by having great discussions, by having an informed decision maker in that room with that person to really talk to them about what your freedoms actually mean and how your freedoms may impact others, how your decisions impact yourself and your family, and how your family would feel if you were no longer with us. And so I think having some really good discussions with people about just the facts, not your feelings or how things should be, but how the reality of what we're living in 2021.
Honestly, are you surprised that the political aspect has taken over so many people's decision making during a pandemic? Are you surprised?
Part of me is really surprised, but part of me, given the political climate we've been in for a number of years, is not surprised. We've had this as a backdrop that's really polarized our country, and I think everything's now become polarized. As simple as wearing a mask, not wearing a mask, or what you decide to do with getting your own children vaccinated. If schools can be open or closed. I think everything that's become a hot button right now is up for grabs.
Jennifer has a question. She's one of our YouTube viewers, and help her with this. She says she often sees the comment, opposing the COVID vaccine, quote, "I trust my immune system." What should she say to someone that just says, "I trust my immune system. I may have had COVID. God gave me an immune system to fight these things off." These are really powerful stances. I get that.
Yeah.
What do you say?
I would say we also have science. God gave us science to understand how these things work. Dr. Hawkinson mentioned, the history of vaccinations for children. Our children don't have these diseases because we have vaccines for them. We don't want to go back in time of having our kids have these horrible diseases that took away our population. And so we have the ability to have science that can really direct us to make decisions that are healthy. I think science, gave us like Advil and ibuprofen. We take those things without cause of knowing what's actually in that pill, but we take it because it makes us feel better. When we go out to eat dinner, we don't question the chef over what they actually put in our food. Some of these things we just trust. And I think trusting science, as we've done for our lifetime, is a great response, that I trust the science.
Trust the science.
I would think a lot of those people too, are not consistent, because it's probably a lot of those people who, after 2 or 3 days of some sniffles, run to the doctor to get an antibiotic when, more than likely 80% or 90% of those symptoms are based on viral infections, which antibiotics and Z-Paks don't help anyways. Or certainly it's running to the doctor if you have a urinary tract infection. So on the one hand, you're saying I trust my immune system, but on the other hand, you're looking for medical therapy. So I think it's just a matter of being inconsistent in your thoughts and actions, and that's really the issue here. But we also have other evidence that clearly shows now, and we heard Dr. Satterwhite talk about this last week when we were on, that those people who were infected compared to the people who are vaccinated when they have gone back and looked at this, and this is in MMWR now, have a 5 times higher chance of having a positive COVID test after infection. So one more reason to get vaccinated. That will even help reduce your testing positive for COVID later on. And this is now, like the second or third good quality study that shows that helps that reduce the testing positive even after vaccination. So I think it's a matter of staying consistent in your thoughts and actions, and you're going to go to the doctor for other things. I think the other major part is it's not just about you as an individual. Yes, more than likely, we've seen it and said it. 85% of people will not have to seek any medical attention at all if they get COVID-19. However, the problem is it's not just about you, it's who can you spread that to, one person down the line or 2 people down the line who may be at more risk of severe disease. So it's about you individually, but that is not the whole story. You have to consider the rest of the community that you're in as well.
And Neil has a question. Good morning to you. Dr. Hawkinson, is there any further research on the efficacy of vaccine for people who had COVID? And then my question to that is, why is that a question?
Yeah.
Is there something where if you've had COVID, the vaccine isn't as efficient? Well,
No, I think it goes back to, well, I've had the infection, so I'm immune. But again, we are seeing more and more data to support the fact that if you get the vaccine, even after infection, you have a wider breadth, more different neutralizing antibodies to those variants that may have been circulating, likely even to those variants that we haven't seen yet. And this also goes to the fact of our T-cell responses. That vaccine offers your immune system, the ability to evolve so that you have a better or wider breadth of protection against new variants that may occur. And again, just as we stated too, the MMWR articles, one was from probably 6 weeks ago, showing that you do have a reduced chance of reinfection if you're vaccinated, even after getting the infection. So it is really important to continue to get vaccinated even after you've had that infection.
Okay, kind of along what we've talked about a little bit, but Caroline has a question. If natural immunity is a thing, why do I need to get vaccinated?
Yeah, I think I just answered that.
Okay, just making sure. So that's a question people get a lot.
So, but basically,
and what is natural immunity?
Getting at least one dose, and certainly the recommendation is to get both doses, but getting at least one dose of an mRNA vaccine after infection, again, helps provide that additional boost to that immune system so it's able to evolve better to create a wider breadth of immune response to the variants that are circulating, and more than likely to those variants that we haven't even seen yet.
Okay, but in layman's term, natural immunity is a thing. It just needs to have a vaccine that goes along with it.
What we are finding, in the basic sciences is that we don't always use antibody levels, but one thing that we can say here is that those antibody levels seem to be higher and peaking in those people that have been infected and then vaccinated compared to those people that have just been infected in the past, especially if they've only had mild disease.
Okay, Lori has a question for you, and we've had this before, and I'm sure it's going to come up again, the pulling back on the vaccine shot. You got to tell us what that's all about. This is for you specifically. How do you know you're not injecting vaccine into a vein unless you first pull back on the plunger? I don't think it's a plunger, but I get it. Yeah. I get it. To check for blood. Vaccinations are to be administered intramuscular, which we know, but that's been a thing. What is this pull out on the shot?
I don't know. I think we'd heard a story about this or something of that nature. Again, knowing the anatomy, knowing the muscle, the deltoid, that shoulder muscle, there's not really vascularity there. There's not arteries, veins, there's not large blood vessels that you're going to stick the small vaccine needle into. And so there's really no to very little risk of ever doing that. Okay. That's just not what the anatomy is.
Dr. Johnson just looked at me, she goes, I have never heard of that. But that's a question that came up over the last couple of months, is that people were like, can I ask the person administering the shot to pull out a little bit so it doesn't go into the blood supply? Is that goes into the vein?
Again, you're going to have, at that point, the only thing that's really around that area are very small capillaries, the smallest of the blood vessels. So there's really, based on just basic or gross anatomy, there's not a lot of a risk of hitting into a vein.
You had not heard that. We get all sorts of questions.
I have not heard that, and I just wonder if people are kind of going down the rabbit hole of all the reasons not to get the vaccine and looking for these reasons and questions to ask versus looking at why I should get the vaccine. As we were talking earlier, I had the thought of, when we think about having little kids and preparing kids for this, one thing to talk to kids about is that we do good for others. And so when we're on the playground, they're that little and they're on the playground and someone's crying, we ask them what's wrong, and we help friends. And so this is a way of teaching our kids how we can help others. And by one simple act of getting our vaccine, we could help our community. So it's a good resource to also teach our kids how we can be communal and help and kind of have collective responsibility for the greater good.
Not just health for you, good health for all. Yeah. Leslie has a question. My friend felt miserable after having the vaccine booster. I felt nothing. Does that mean her body responded better? Dr. Hawkinson.
No, again, there is no correlation with post-vaccine symptoms or signs and the amount of immune response and immunity and protection you get from the vaccine.
Okay, I have a question for you, Dr. Johnson. Okay, Isaac wants to know, and I like this because it makes sense, but work us through it. Mm-hmm. As we learned during the 2020-21 school year, schools have turned out to be safer environments than we thought they would be. How much do you think that might be influencing parents to decide not to get the vaccine? Maybe they're just not as eager. Yeah. Maybe kids aren't as high risk. Schools are really safe. Well, they're safe because everybody's masked and distance. We don't want to do that forever. So we have to get vaccinated to get the masks off eventually. But do you think that might be playing something into it? Is that, kids seem pretty safe?
I think so. I think for the most part, most kids have been very safe at their schools with a mask on, socially distanced in little pods. And so I think parents can take some thought process about that and say, they were so safe. Do they really need the vaccine? Because we haven't had any low risk exposures. We haven't had any exposures or positives in our classroom, so maybe we don't need it. The problem with that is that to maintain that not needing it means our kids will always be in masks and socially distanced and not able to do the full force of what school offers. And for parents, we are limited in our ability to see our kids at school because we will still have social distancing, parent restrictions, and masking at the schools. And so I like the idea of keeping our kids safe. I actually love the idea of keeping our kids safe. But we know that there's going to be a tool very quickly that will really be the ultimate safety tool that our kids should have in their tool bag, and that is being vaccinated against COVID-19. And if we can get our kids all vaccinated, for those, I think 6 and up will be Pfizer first, that leaves out some of our kindergartners and preschoolers right now. But if we can get this next group of kiddos vaccinated, that gives them a chance to go through all the sports activities they want to do in a more open manner. And again, as parents, we get to be there and be present for these activities if our kids are vaccinated, schools are safer, and we can keep some of those things in place. I am a fan of masking in the fall season because no one got the flu in our household.
That was
pretty
darn nice.
Yeah.
You probably didn't miss a whole lot of work taking care of kiddos.
Kids didn't miss school because they were sick. So I like the idea of keeping them safer in the fall and winter to keep all those bugs and viruses at bay.
But Dr. Johnson, wouldn't it be nice though that if our kids didn't have to wear masks? Wouldn't that be a nice day? I was just thinking the other day, my kid they're in the third year, part of half of the first grade, all of second grade, and now we're into the third. So it's like, gosh, it really would be nice. They're simply necessary right now. And probably will be for quite a while, but that'd be nice for them to be a thing of the past at some point. But I agree with you on the flu. I would like to have that gone too. Hey, Dr. Hawkinson, Leslie has a follow-up question about her and her friend that both got the booster and felt differently.
Yeah.
But she wants to know, okay, so take us back to med school on this one, but she wants to know, what's happening inside the body of my friend who got fever and chills from the shot? What is her body actually doing that my body is actually not doing? Why the different response?
Again, humans are different. There are genetic components. These are all very complex genetic components. What is your body doing? So we know that you are starting to have some of that immune response, release of those cytokines, those chemical signals to your immune system. It's not to say that it's not going on in your body, but again, everybody's reaction is different, even from one dose to another. But basically, when you are having those signs and symptoms, it's basically that immune reaction, that inflammatory reaction going on either right there at the site in your shoulder for that local reaction, or if you're having chills or sweats or headache, it's more of that systemic reaction and just that inflammatory reaction that is going on, release of those cytokines, those chemicals to help your immune system now start to kick into gear and really start to get adapted to that spike protein so that when you see it with natural infection, those immune cells can ramp up much quicker than just without being vaccinated.
Couple more questions. Shirley wants to know, can you get COVID-19 more than once, or would that be considered the variant the second time? Is that safe to assume that it was Delta?
Yeah, I think early on we did show that reinfection was probably rare, but I think you also have to take into the caveats about what is that time from your first infection when you get that second. Is it more than 90 days? Certainly getting it more than 90 days out is more common than within that 90 days after that first infection. And if you had COVID-19, say in 2020, and then got it again in 2021, more than likely in 2021, especially in that anywhere from late spring to early summer, from then on, it's probably Delta variant, yeah.
Okay, so Julie wants to know if someone thinks they were never tested, thinks that they had COVID way back in March of 2020. So at the very start, how much immunity do they have at this point? Certainly not enough to not get vaccinated, right?
Yeah, if you think you had it, it depends really what were your symptoms, how mild was your illness. Stated before in one of the other answers, we certainly know that those antibody levels for people that had mild disease were certainly lower in general than people that had more severe disease. But we also know that the immune system does have that memory come into play. So it's memory B cells that are able to ramp up quickly after you see the infection again. It's those memory T cells that start to take effect as well after you see that infection again. But again, what we're seeing also is that you have a better chance of having those neutralizing antibodies if you see another variant, if you've been vaccinated now after infection, especially if it was a mild infection, compared to those people that only had that mild infection and recovered pretty easily.
Okay, last question is going to Deb. Good morning to you. What about people who had a reaction and could not get the second vaccine? Do they have any protection at all? One is better than two, right? Or one is better than none, right?
Absolutely, one is better than none. I would really revisit that issue of not being able to get this vaccine, or again, maybe go with a different platform, like if you got an mRNA vaccine to start, getting that Johnson & Johnson vaccine for that second dose. But So I would really revisit exactly why you can't and speak with your physician about that.
All right, great information today. We're going to get to our final thoughts, but I want to let anyone know if they're heading out to the Chiefs game tonight. The Chiefs, along with the health system, they are offering and hosting a free COVID-19 vaccine booster clinic. This is going to be outside the GEHA field at Arrowhead. This is right before the game. This is from 4 until 7 in the Founders Plaza area outside of Arrowhead Stadium. That is tonight. It is free. It is put on by the health system and the Chiefs. So if you are lucky enough to head out for Monday Night Football, get your booster while you're at it. Dr. Johnson, always good to have you with us.
Good to be here.
Final thoughts. What do you want us to know as we head into the next couple of weeks of when we get this news that our kids are okay to get vaccinated? What should we take with us?
Take with you the fact that your kid's going to get safe. They're going to get vaccinated and have the chance to be able to return to more normalcy in school and play. And so having conversations to let them know that, hey, today is the day we're going to get vaccines. Take your kids by the donut shop, get some donuts, take them to get their vaccine. As soon as they get their vaccine, they get to eat a donut or candy or whatever else is their kind of food of choice. Also, make sure you're checking in with your kids. As a psychologist in a psychiatric hospital, make sure they're doing okay. And if they're not, to utilize resources by contacting, if you already have a therapist, school counselor, your PCP or pediatrician. But if they are telling you that they are not safe, that they are having thoughts of killing themselves, to immediately call 911, go to your nearest ER, call Marillac to make sure kids are safe. So we want them safe from COVID-19, but also we want them safe from the effects of depression, anxiety, suicidal ideation.
And can you please reiterate, because I've talked to Dr. Douglas about this too, that talking to your children and asking them if they've had suicidal thoughts does not make them have suicidal thoughts. So tell us about that, because that's really important. I think parents don't want to talk about it. They don't want to see it on TV because they think it might give an idea. That's not the case.
That is not the case. By asking them the question, we do not implant the idea or the thought that your child may be struggling with depression, anxiety, or suicidal thoughts. But by asking your kiddo, they get the chance to understand that, yes, as a parent, I'm here, I'm open, I want to talk about these things. Let's not shy away from them. We often use the language of, are you feeling okay? And that could be code for, are you going to have thoughts of killing yourself? We need to use the actual language of, are you feeling like you want to die? And if they say yes to that, to ask them, are you thinking of ways that you could kill yourself? By asking that very direct question, you have the ammunition you need to get your kid the help they need.
So ask questions.
Ask direct questions. Very direct. Don't
tap
beat around
dance
the
around.
bush. No, just say, are you having thoughts of not wanting to be alive? Do you not want to be alive? If they say yes, are you thinking of killing yourself?
Ask questions, and more importantly, listen.
Listen.
And as a parent, if you have questions, where should you go?
So, pediatrician is a good spot. School counselor is a good spot. Your local community mental health center is also a great spot. If your kid is in an imminent danger of themselves or others, call 911 and get them safely to a hospital. The hospital will call Marillac and check for a screening to see if we have beds available, and if so, get the process going of getting them to an even safer place.
I just wanted to circle back to this topic. It's just so darn important. And I just want parents to feel like it's okay to talk about it. It's okay to have a kid that has some issues going on.
Correct. Because we are here. We are here to help your kid and to help you. And so ask the questions. We are also coming up to stressful times for our older kids, for our high schoolers, where they have finals and midterms coming up, and for middle schoolers, where that increased stress from academic pursuits, it impacts them. And they have pressure. And for our student athletes who are doing a million things at once, that doesn't change. And for our student athletes who may be losing things because COVID canceled a game, it canceled a playoff, those kids are stressed.
And don't assume that if they're not saying something to you, that there's not something going on in that little brain of theirs, right?
They're quiet creatures as they get older. So make sure you're having the questions, you're talking to them, that you're having the dinners with them and really checking in so they know on a daily basis, nope, mom and dad are there. They may not have all the right questions or right answers, but they're here and they're giving their best effort. So parents, give your best effort.
Great advice. And as far as the vaccine, donuts do go a long way.
Donuts are amazing.
Great advice. Thank you. All right. Dr. Hawkinson, final thoughts today.
Yeah, I mean, I would agree with Dr. Johnson. That's such an impactful message there, and please listen to her. Also, get your kids vaccinated. Get them their typical childhood vaccines for the vaccine preventable diseases, because we know the devastation, the complications that those diseases can cause. So it's not just COVID, but it's getting them on the regularly scheduled vaccine schedule. Please get that. And remember, the kids take the cues from you. It'll be okay. It's a small shot. It doesn't cause any large problems or issues. And hopefully they will be available soon. The vaccines will be available soon for those younger age kids as well.
Thanks to both of you today, and thank you all of you for being with us on this Monday. Coming up tomorrow, we are going to continue this discussion as, of course, we edge closer and closer to yet another age group getting vaccinated. We're going to break down what you will need to know once it is approved. Once it is, where you can go, where you can get it. We'll have all that information starting tomorrow at 8 a.m. Have a great Monday. We'll see you back here tomorrow.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.